All right, so let's talk about now getting rid of some neck pain. The neck itself, pain generally comes from the facet joints. That's these joints in here where one bone joins the other. And you can actually see how there are a number of joints in the neck, all right, including the very top joint, and they're on either side. So these joints themselves are responsible for a lot of neck pain. The thing that probably aggravates your neck the most is looking up and to the left or up and to the right. Down and to the left or down and to the right, and it doesn't tolerate bending to the opposite side where it actually starts to open the joints. It doesn't like opening the joints. So we're going to use a technique which is called the traffic light activity, but in COVID times you could actually say it's more the in-home isolation activity as well. What you do is you take the finger pads, just this area in here, and you put them on the back of your neck on the opposite side. Slide your hand down the throat. And then slide your hand down the throat on the other side. What you're effectively doing is you're closing the joints. You're not actually opening those joints by looking up in that way. You're closing them down and you're sliding them down like this. And then you do the same on the opposite side. And you do 5. Now, I've said that this was the traffic light activity when you're at the red traffic lights. Essentially, you can do 5 in one direction. You can alternate. Or you could do them on the same side. And then on the other side. Now sometimes you might actually feel the pain more into the shoulder blades as well. You can do the same thing. You can pull your hand down in this region in here over your traps. And then also on the opposite side as well. So it's very good to get your hands to be able to self-heal and support you in this healing process. Probably more importantly is what to avoid. And what to avoid is actually a crucial part. Who wants to put pain in their body? But it's easily done. And it's easily done when you've got a lot of video work and you're looking down and your head's in this position and it's held low. If you can, put your elbows on the table and type with your elbows on the table so that your chest is popping up in that direction. If you're watching TV, you could do the same thing. You can actually take your chair, just turn it around so that the backrest becomes a front rest. And sit backwards in the chair, lean forwards in the chair, and rest your arms on the backrest of the chair. And now what you're doing is you're actually popping your chest, allowing more air to enter into the lungs, and you've got your head back over your body, and it's not in this position where, for example, you're in the couch. Your legs are up, and you're looking at the TV like this. And that's not actually the right thing to do. Very comfortable, but comfortable is dangerous. And you don't want to get too comfortable because you can spend hours in comfortable positions, and that actually undermines your neck. So it actually starts to put your head forwards, and it creates problems, all sorts of problems. We'll go through some of those problems now as well. I am going to talk to you about your lower back, and I'd just like to share with you a little helpful strategy with your lower back. So obviously anything sitting in couches with your legs are up, it's just no good for your back. What you can do again is sit Western style with the backrest as a front rest. And one other useful tip for you whilst you're in the home as well is to walk tall or even jog with your hands down low and just get some of the blood circulating in through your body and allow yourself to be in the upright position. The more upright you are, the taller you are when you jog, the more you start to activate those muscles in your lower back. And I'd recommend that if you're doing quite a bit of work from home now, that you get up probably every half an hour to an hour and actually go for a little bit of a jog for 30 seconds to a minute. And really get those muscles activated and just lifting you up as tall as you can. Now, you won't believe some of the changes that are about to be presented to you coming through, but we'd love to be able to show you the impossible being made possible. Here you go. So let's just take a look at a few things for a moment here. What is this big idea that we're referring to? The idea is that our bodies are marvelously created, but they can actually be marvelously recreated. So if you're in poor health, that's going to be a real issue for you. We want to be able to turn on, somehow just turn on the electricity, the power in the body to be able to make it heal again. And it can do so from menstrual disorders to mood disorders to appearance disorders, to pain disorders, and I'm going to show you some of these things now. What about this fellow here? This is an extreme version of a rounded back, kyphosis, and what we have here is a man who's applied himself diligently. Instead of suffering from pneumonia every season, this fellow here hasn't had pneumonia since 2016. Hospitalized 4 times in 1 month prior to attending the clinic, you can see the shape of his back and how it's compressing his lungs. Within 2 weeks, he's starting to make changes in this same line. That's where his spine was. Now it's actually changing again. Now it's actually changing again. This is the same fellow, which would normally have surgery and over 24 screws put in his back to be able to fuse his spine and stop him from having lung collapse. He did it all by himself. 90% of his treatment was done from his home. This lady, she's 82 years of age. She's grown 5 centimeters in 7 weeks. Now, surely she can regress and she can go back down and get more and more compressed, but the interesting thing here is that she didn't. She actually got better and she continued to grow taller. So each square that you see on this grid represents 5 centimeters. Okay, so that's the appearance model. And that's for the elderly as well as the not so old. But how does this big idea actually apply to other areas? Here we go, you. Vanessa. Vanessa is 35, married for 10 years, experiencing pain, getting worse, has 2 menstrual bleeds per month. One lasts 7 days, the other 9 days. And on each occasion that she has a bleed, she actually has 1 week of premenstrual symptoms. This lady is either premenstrual or menstrual for 8 years. Her marriage is suffering as a result of this. And she's suffering. She's missing out on her children. So let's just take a look and see what's going on. This is a spreadsheet. So what we've got in here in row 2, we've basically got the ability to put all of the symptoms down up in here. In later spreadsheets, as you just saw in the previous case in here, we color-coded them so that they were different. So pink was for menstrual, golds for energy, reds for cardiac and heart and blood. Mood is I'm feeling blue, so that gets a blue. Grey is for thinking, grey matter, concentration, calculation, memory. Black is for nighttime, so that's sleep. And then there's the additional comments in here. So this lady in here started only like a week ago. This one in here started January 10, 2018. Look what happens to her menstrual cycle. Now, where is that? Pain during sleep, interrupted sleep, disparate. Let's just take a look. Breast pain, mood, difficulty swallowing, panicky, itchy skin, bowel habits. Let's take a look. Bleed duration. Here we go. Remember, it's January what? January 10. Now, her bleed, delayed cycle start by January 28. This is awesome. Her cycle went for 7 days instead of 9. Let's just take a look. Here we go. Day 7 finish again, but this time instead of, when was that? January 28, she's now pushed through to February 20. So that's already 3 weeks. That's a lengthening of her cycle by 1 week in the first cycle. And let's just take a look at the next one. In March 17 and February 20. So 7 days plus, it's 25 days now to the next cycle. That's awesome. And March 17, we'll take a look again. And here we go. May 10. For goodness sakes, her cycle even lengthened that time as well. So this lady actually, and it lasted only 6 days, but you can see the color in the spreadsheet. See how it's changed, it's gone all green, whereas that's where it was. So what we've got is a way to make visible the invisible, her mood, her tears before, her daily panicky feeling. It's green, none, it's just gone. Difficulty swallowing. So this is exciting, but let's just keep this video fairly short and as an introduction. Let's just go here to lung function because this is COVID time. So take a look at that. You can be able to pause this video and just take a look where you are in your age range and what your lung volume is. You can get a spirometer fairly cheaply, and you can basically take a look at lung function in here. For people like Jeff, he's improved out of sight. People like Anna improved out of sight simply because the chest cages expand. Okay, so that was a brief 10 minutes now of what to do and what to avoid in terms of what you can do at home and how you can reposition yourself. It also showed you some of the longer term changes as well with people that have been receiving habit-driven health care and the remarkable transformations that were achieved not only in appearance but also in health status as well. But if you'd actually like to ask some questions, please leave your comments below in the channel or send an email to St Jude's Clinic, admin@stjudesclinic.com.au. Please click on the subscribe button and also on the bell icon button so you can be made aware of more posts being sent to you that would help empower you from the home and also what's achievable. We look forward to sharing more of this information with you. This is Daniel Dahdah.